direct removal of breast tissue. So this gentleman comes in, is unhappy with the chest, and would like to have it reduced. On examination, he has both lipodystrophy or fatty tissue in the chest, as well as also having some breast tissue. The breast tissue will not be amenable to liposuction because it's pretty much a solid tissue, so that will have to be directly removed. The way I like to do it is I like to do the liposuction and remove all the fatty tissue that I can, and then through that same incision go and pluck out whatever breast tissue remains, and that way we'll be able to make the chest as flat as possible. So to begin with, I'll infiltrate the wetting solution or the tumescent solution, and then we'll do the liposuction. The last thing we'll do is we'll remove the breast tissue, whatever remains. So we'll be back to show you some of those steps in just a little bit. Okay, so we're back. I'm infiltrating the tumescence or the wetting solution. So that's going into the chest right now, and that's going to start making the chest look bigger. And again, that goes in to help out primarily with bleeding and then with the pain afterwards. So you can see the chest really kind of puffing up, and that's the way it's supposed to look. It's supposed to do with this wetting solution. So we'll do all these different areas on the chest, centrally, superior, and laterally, and then we'll come back and do some pretty aggressive liposuction. And then, like I said, whatever the remaining tissue is left, that will be the breast tissue, and that will have to be directly incised. All right, so we did the infiltration. Now we're starting the liposuction. So I'm going to very aggressively try to remove as much fat as I can here, but inevitably there'll be some breast tissue that will be left, and then that will have to kind of directly excise, and I'll do that through the same incision. So you can see that I'm starting to get some fat removal starting to come out here. And not a tremendous amount you're going to get on the chest, but what we remove will make a big difference in this kind of this small area. So I'll keep going through this process until I feel like I've had enough fat removed, and then we'll move on to see about removing some breast tissue directly. Okay, so I've done the liposuction on the left chest, so all of this area has been done. You can compare it to the right, and you can see, of course, this is still infiltrated, but how much fuller it is. Now, on him, he still has a little bit of breast tissue right here, actually less than what I would have predicted going in, but there is still a little bit right here in the areola area that we're going to take out just to make this really just as flat as possible. So the next step is I'll make this incision just a little bit bigger, and I'll go in there with some forceps and grab that breast tissue and remove it. We'll come back and show you after I remove some of that breast tissue. All right, so we're back. So I went ahead and I directly clipped out some breast tissue. Really on him there was less than what I would have anticipated going in, but even just this small amount will decrease that fullness right under the areola. So now we have the chest really pretty flat. I think he's going to be happy with that side. You know, when you compare that to the preoperative photo there and see how full that is. So the next step is basically we're just going to go to the right side and do exactly what I did here on the left side, and then we'll be done. And we'll show you after I've completed both sides. All done. So the liposuction has been done on both sides, and I directly removed some of the breast tissue. It wasn't as much as I thought, but some breast tissue did come out right here under the areola area. So you can see how flat that is and how contoured that is as compared to the preoperative photo. Common procedure that men come in for and like to have taken care of.